Hi, my name is Lisa and I am a nursing student and I'm taking Pathophysiology. It is the disclaimer that I'm not a licensed medical profession and I'm not a licensed instructor. This is just for my final grade. I am taking Pathophysiology because I want to be an ER nurse. The most interesting thing I have discovered so far through Pathophysiology is the fight or flight response, which is the norepinephrine-epinephrine response, which whenever something bad happens, your body reacts and its blood pressure, it affected how you're thinking, your skin cells are affected just from those two fight or flight response chemicals. It is important for a medical professional to know pathophysiology because of the disease process. It usually starts with nutrition or at a cellular level, so for us to understand the beginning, we can treat it better. I'm going to talk about the Lewy body disease, which is, it is often confused with Alzheimer's. The thing about Lewy body's dementia, it is a genetic, it is overrepresentation of EPO-lipoprotein, E subtype, EPO-E4 genotype. And it is genetic and just passed down from family. It can skip generations. Etiology, it alters levels of neuromodulators and neurotransmitter, disrupting information flow in your neurocortex, which is inside your brain, and it affects different type of pathways in your brain, which interferes and comes out to visual hallucinations, daytime drowsiness, Parkinson motor features, which is the shaking of the hands, anterograde memory loss, excessive function deficits, decreased alertness. Even with good adequate sleep throughout the night, they are still having altered levels of alertness and attention span. They will have visual, facial impairment, unexplained syncopes whenever a person passes out, and they don't have a reason for it. Non-visual hallucinations, rapid eye movement, sleep disorder, neuropletic sensitivity. They will also confuse family members as people who they know they will no longer recognize, and they will also have depression. One thing about Lewy bodies, because it is so hard to diagnose from the initial symptoms, it's often confused with Alzheimer's. So antipsychotic drugs for Alzheimer's will increase the effects of Lewy bodies, so it'll make it worse if you're misdiagnosed initially. The labs for it is the chemical panel, the complete blood count, thyroid studies, vitamin B12 studies. The visual diagnostics for it can be done by MRI, CT, and PET scan, and the treatment for it is cholinesterase inhibitors, second generation antipsychotics, antidepressants, benzodiazepines, and dopamine precursors. Again, we need to start understanding the disease process more, and through pathophysiology, we are able to learn and get better treatment. So a lot of things that are often misdiagnosed, if we learn the symptoms initially, we can treat it better and we can have better outcomes for our patients. Thank you so much for listening. Remember, I am not a licensed medical professional.